Sloan Boyles has been seeing Dr. Brooks since she was 2 months old. And she came because she had acid reflux, and my pediatrician had given us a compound drug that was inhibiting the absorption of iron and zinc and various other things that were really red flags for me. And I thought there's got to be a different way of doing this. I don't want my 2-month-old whose brain is developing at a rapid rate to be suppressed by a drug that I'm giving her because she can't keep her food down. So we've been doing CranioSacral for 2 years now, a little over 2 years, and I'm sure we'll be here a long time. But one of the things that I have to battle a lot are people asking me, why do you do this? Why do you go out of mainstream? And what's so special about CranioSacral? What is CranioSacral? I like the fact that Dr. Brooks will get down to the reason why. And that's why I want to know why. I mean, when I walked in this morning, she said, Megan, Sloan has little red dots on her face. What is that? And I had to go through her diet from yesterday, and I realized there was something new that I gave her. And it's those things, just simple little things that you don't, most people think, oh, it's a child and she probably drooled, or she has, I don't know, sensitive skin. Well, it probably isn't. It's actually probably something that she's eaten that her body isn't agreeing with. And that is so valuable that I have learned through Dr. Brooks. I mean, being a parent is completely overwhelming, and to have the knowledge that Dr. Brooks has is really amazing.
Like Dr. Brooks's practice is called whole child wellness. She fixed the digestive issue, but she wants to make sure that everything about them is healthy. We saw immediate changes in Angel, and it was about probably 2 to 3 weeks till we found that she was like a completely different baby.
Even though Riven is not diagnosed with autism, he does exude many symptoms of autism. And after doing the research, I found out that this isn't just, a rare occurrence. This is happening to kids all over the world. Same exact stories, literally. I mean, it's really surprising. I was a little bit hesitant because, you're never sure if someone's going to be selling you magic beans, or, if there really is hope for recovery and help for him. But there is, because, he's living proof of her work and that her work works. Actually, he used to wave hello and goodbye to us, and if one of us would walk into the room, he would immediately react and look at who was coming into the room. He stopped doing that at a certain point completely, and to this day he still doesn't wave. He's getting there. He did it once, but he's getting there. If you're looking for somebody to talk to, there are tons of parents out there who are going through the exact same thing that you are. And there's also doctors like Dr. Brooks, who is here to not only hold your hand through it, but really kind of be the person who holds all the weight. She'll take it all from you, and she'll take care of it. It just seems like all these therapies are really overwhelming, and the way that she approaches things just enhances all the other therapies that you get. Even if you've covered the basis with all the therapies, like Riven, for instance, he has OT therapy, speech therapy, and then specialized skills training. He's doing all 3 of those once a week. If he was just doing those, we would see improvement, definitely, but it would be at a much slower pace, and we wouldn't get that clarity that we get through treating, his issues biomedically. So it's very important to actually run the tests and see in front of you exactly what's going on the inside, because you can only do so much blindly.
First came in and right away brought some other labs that we had and reviewed all that with Dr. Brooks. And then had us go through a lengthy questionnaire, talk through all those things together with my husband, with her. And then from there came up with a game plan of what needed to happen, because there were very big shifts in our daughter's behavior. So she would be happy one minute and then just turn on a dime and be angry and crying and physical with people, not harming anyone, but just she could change so quickly. school was a major challenge at our house. So homework was a battle. Getting dressed in the morning, did not want to go to school at all. Hated being at school. She felt very stupid at school, and so knew that some things needed to change for her. And then through testing, it really opened our eyes to see that there were so many underlying issues that weren't as overt as you would expect. And so once we identified, or Dr. Brooks identified, the major issues first, started on supplements and kind of working through those. And all along the way, Dr. Brooks her rapport with our daughter was incredible. Just how our daughter would do anything for her. And I think that says a lot about who Dr. Brooks is and the relationship she has with her patients and with the family. Like it's the family, it's not just our child. So a normal appointment would just be that we come in, she checks her back, checks her spine, checks her neck, everything first. And she really knows. Like, we came in one time and she was like, Faith, what did you do? And she had fallen off her bike. And she could tell just from feeling along her spine that something was off. So that was just an indicator that there really is a lot going on and that she can feel just with her hands without us even telling her. And then she'll flip over and do the craniosacral, and that takes 10 to 15 minutes depending, which our daughter loves. That's like her favorite part, is like a little head massage. And then just kind of going through how are things going, how are the supplements going. And so kind of coming full circle after being in her care for about 9 months now, our daughter is happy. She has so much more self-control. Her ability to attend to a task she's just more calm and steady. Not perfect. None of us are perfect, but just a marked improvement of just how she's able to handle herself and interact with other people without feeling as frustrated as easily. Dr. Brooks has given us a lot of strategies on how to help her because she has a slower processing. So having too many tasks at once is overwhelming. So she's helped us to kind of break that down, to give us strategies to help her be successful at home and at school too. So we've come a long way. We've come a really, really long way.
Dr. Brooks is 110% dedicated to these kids. She puts her life into healing these children. She is constantly educating herself on how to better care for these kids. She's 24/7 thinking about these kids, and she is definitely the go-to person for your child. You can put your child's health in her hands, and I can guarantee you'll be very happy with the results.
So we came from no hope, or she was bad, head banging, angry, crying, kicking, screaming all the time, eating 2 foods. But today, a year and a half later, she's using, she had like 4 words, and she's probably got 70, probably has 70 now. She follows directions, she's eating, pretty much all her sensory issues are gone. She doesn't toe walk or hand flap anymore. She smiles, she's happy, so happy. Loves to play, and she's so lovable. She's just a different child. Don't give up. And you've got to find your doctor. I think Dr. Brooks is amazing because because she taught me so much too. Not only because she treated Carly Main, but because she taught me how to help her. But don't give up, because it's totally possible. Absolutely possible. I never thought we would be here. I thought that we would be homebound for the rest of our life, because she couldn't go out in public and act appropriate or even tolerate it. But today, every morning she wakes up and says, I want to go shopping. It's her favorite thing to do. And it's possible. And I know we have a long way to go, but I know we're going to get there.
Hello, my name is Dr. Amber Brooks. I founded Whole Child Wellness to bridge alternative and traditional medicine by providing individualized and comprehensive approaches to pediatric wellness. I want you to know as a parent that there is hope in recovery and healing in children. Their bodies were designed to be perfect. I tell parents that they do not have to make this journey alone. That is why I'm here. Remember, tomorrow is a new day. Take the next step in seeking help with faith, knowing hope and healing will follow.